Hello. At Mental Health America Lakeshore, we understand navigating the mental health system is challenging enough. No one should have to fight their insurance company to access needed care. In partnership with Cover My Mental Health, a nonprofit organization, this video supports patients, families, and clinicians facing barriers to mental health services. Cover My Mental Health provides education and guidance to help individuals respond to denied insurance claims and overcome obstacles to care. Understanding your rights and advocating for your coverage is critical in today's complex system. This resource will help you take informed steps to access the care you deserve, because mental health treatment is a right, not a privilege.
Hi, I'm Joe Feldman. I'm the president and founder of Cover My Mental Health. We're a nonprofit that provides resources to patients, families, and clinicians to overcome insurance obstacles to mental health and substance use disorder care. I started this project because our family faced insurance obstacles to care for multiple family members, and we struggled to deal with the challenges of overcoming those obstacles. And I've learned quite a lot about how patients, families, and clinicians can advocate for themselves and overcome insurance obstacles. And so I started Cover My Mental Health to provide those resources, and especially to provide encouragement that you do not have to take no for an answer, and you're entitled to the coverage that you paid for. So I want to share with you in this brief video some of the key resources of Cover My Mental Health. I encourage you to visit our website to learn more, and you can watch more videos and get more information and see the downloadable resources that we offer. So let's get started. First, I want to talk about what our expectations are when we have health insurance. Most of the time, we don't even think about what our expectations are because the expectations are met and it's sort of not a big deal. But sometimes when it comes to mental health, those expectations are not met. So what are the basic expectations? Well, first, we expect that a health insurance company is going to provide us access to competent clinicians who we can access sometime soon and somewhere near us. Now, soon and near are going to depend on where we live and what the scheduling looks like. But we know that soon is not a year from now, and we know that nearby doesn't mean having to drive many, many hours to get care. Second, we expect that those clinicians are expert in working with us to determine what treatment that we need, and that they're part of the insurance company's team, if you will. And so the insurance company should then cover whatever treatment those clinicians have determined is right for us or is right for a family member. And then as the treatment progresses, could be at a higher level of care or different care, could be a different medication or a change in whether medication is needed at all, that ongoing treatment is also going to be covered by insurance. Finally, we expect that the claims are going to be paid. Now, we understand that deductibles and copays are part of having a health insurance policy, but we expect that the claims that are for services that these expert clinicians have determined is right for us, those claims are going to be paid. And in the event of there being a dispute, we would expect that the insurance company is going to resolve that dispute with the patient's best interest in mind. So sadly, those expectations are too often not met. And that's where Cover My Mental Health comes in to provide resources to help you realize those expectations. So first, I want to talk about some of the tips that you can find on our website. On the homepage, you'll find a button, how to use our site, and there you'll find some tips. I just want to mention a couple of them. One is when you're talking to a health insurance customer service rep, take notes. So it's going to be useful later, potentially, if you have documentation about who you talk to, when you talk to them. I always ask for a badge number, an employee number, so that I can keep track of who I was speaking with. And then write down what was discussed. What did you agree to do later? What did they agree to do later? What agreements have they made to help you access the care that you have paid for? I also encourage you not to discuss clinical matters with a customer service rep. That's not the purpose of the call, and it's not something that they should be asking you about. So just if they ask you, well, how are you doing, or how is your family member doing? It's best just to say, I think we'll leave that to the clinicians. Finally, a tip that's turned out to be much more valuable than when I first put this on the website is this one. There's an authorization form on the website of every health insurance policy, and that gives you the ability to authorize someone to basically be on your team. It's like a healthcare power of attorney, but it's very specific to this health insurance policy that you have. And it means that you can find a relative or a neighbor or a friend who can work with you as you specify in the authorization form to deal with insurance companies when there are questions. So that's a resource that you have that can broaden the team who's working with you to be sure that you get the coverage that you've paid for. So let's talk a little bit more about what it means to expect access to a suitable clinician. So as I mentioned earlier, suitable means three things, really. It means, first of all, competence in the particular area in which you need help. So for example, if a family member needs help with an eating disorder, the clinician should be an expert in taking care of people with eating disorders. Or if you have a need for someone who has expertise in, say, severe depression or OCD or some other specific condition, that's what you should be able to access. And you expect that you'll be able to access care somewhere near you and sometime soon. It's your responsibility, of course, to use your network directory to try to identify a clinician who's going to have those characteristics. It could be, though, that the network directory isn't up to date or just falls short. This is a worksheet that you can download off of our website that gives you the ability to show your homework, to show that you have looked in the network directory, and you can write down on this worksheet the names of individuals in the directory, and then what was the outcome of your search to see if they were competent and available near and soon. So it could be that you reached out to Dr. Smith or Therapist Smith, and it turns out that they're not in the network anymore. Or maybe they were never in the network and they don't know why they're in the directory. Or it could be, and we've heard this story before, that they're actually deceased. Or it could be some other reason why the directory was not accurate and you couldn't get an appointment. By completing this worksheet, you can show that you've done your job. You've done your homework to see if you can find a clinician in network suited to your needs. And then you can go to the insurance company and say, I've done my homework and let me show you my work. And now I need your help either identifying a clinician who's in network who for some reason I haven't been able to find, or to pay for a clinician who is not in the network so that I can get care for the particular need that I have as if the clinician was in network. Now let's talk about one of the most challenging and I think in some ways confusing areas in which insurance companies raise obstacles to care, and that's denials for not medically necessary. And this might also show up as a prior authorization that is not offered, or suggestions that some other form of treatment than the one that the clinician has identified is the one that they'll pay for, or some medication is not going to be paid for. So let's talk about medical necessity. So if you look in your insurance policy, you will see language that says, we will pay for care that is medically necessary. And so as shown on this chart, medically necessary is an insurance term. It's a legal term. And sometimes the definition of medical necessity can be limited to crisis stabilization and not to recovery, which is, of course, what clinicians are focused on. Now, clinicians are trained in do no harm. That's the Hippocratic Oath, which is over 1,000 years old. They're trained in how to use safe and effective medications and treatments. And most importantly, for our purposes, they're taught what are the standards of care. So they're taught the standards of care that have been developed by their peers and reviewed by nonprofit organizations dedicated to documenting what is the standard of care for a patient that has the following clinical condition. And the focus is on recovery. So on the one side, you have an insurance company saying we'll pay for care that's medically necessary, a legal term, one that clinicians are not taught because it's legal, and standard of care. That's what clinicians are taught. And so when you have a gap between medical necessity and standard of care, that's where you get into a situation where there could be a denial that doesn't make any sense because you've got two different standards that are not necessarily the same. So how do we eliminate any space between medical necessity on the one side and standard of care on the other? So a few years ago, I was the lead author of an article on medical necessity letters published in the Journal of Psychiatric Practice. The goal of this article was to teach psychiatrists and other clinicians about this particular tool that can help close the gap between medical necessity and standard of care. It's called a medical necessity letter. And this article taught clinicians what a medical necessity letter is, how to write one, and provided a template. Here's an image of the template medical necessity letter that you can find on our website. It's a new and improved version of the one that was in that original article. The way to think about a medical necessity letter is this. It's like a conversation between the clinician and the insurance company. And the conversation goes like this. Let me introduce myself. Let me tell you about my training, my practice. Let me tell you about my assessment of this patient and any relevance that I should accord to the specific care that they've had that maybe hasn't worked or hasn't worked as expected or had some side effects. And then let me tell you the standards of care that I have determined are applicable here and therefore the go-forward treatment plan. And then it's signed by the clinician and it's attested to be medically necessary. So it's the merging of standard of care and medical necessity. And this is a letter that would be provided to the insurance company. It can be communicated directly by the clinician, or it can be communicated by the patient. And we have on our website a downloadable transmittal letter that you can use that says, attached is the medical necessity letter from my clinician. That's a really important way for clinicians to advocate for their patients. Now, it could be that you've provided a medical necessity letter and the care is still denied, or you've provided a worksheet that you can't find a clinician in your network who's suitable, and you're still not getting access to the care you need. So let's talk a little bit about some steps that you can take if at first you don't succeed. Here's the first one. It's to request a copy of your complete claim file. Now, why is this important? Because your claim file might include information that gives you clues about the decision-making within the insurance company. And you can download from our website a letter that spells out exactly what I mean by all. When I say I want the complete claims file, I want all the documents. Here's what I want in that transmittal. I want you to send me everything. And so it's going to be a copy of the policy, which you probably already have or you should have. It'll be a copy of every explanation of benefits, every denial letter, maybe some other documentation. But most helpfully, it might have documentation that explains their determination that your care is not medically necessary. And that's going to be quite helpful. It also might not have any documentation about why the care is not medically necessary. And if they're obliged to provide you all the documentation and there just isn't any analysis of why your care is not medically necessary, that's going to be helpful when you go back to the insurance company and say, this care is medically necessary. You have no documentation that's contrary to what my clinician has said, and now I expect you to pay for the care. Let's talk about one other step that you can take if at first you don't succeed. It's called a formal insurer complaint. So let me tell you first what it is not. It is not a formal appeal. That's something different, and that's a legal step that you can take that's spelled out in your insurance policy. It's also not a regulatory complaint. So you can't make a complaint to a state regulator or to the federal government, to the Department of Labor about an issue, but a formal insurer complaint is something different. It's made directly to the insurance company to say, for example, I have submitted a medical necessity letter and basically you're ignoring it, and so I'm submitting a formal complaint. So what we've learned from talking to ex-insurance company executives and what individuals who've used this technique and have reported their stories to us, and you can find these on our website, is that a formal complaint is something that an insurance company is obligated to report to their regulatory authority and to their accreditation body. So all insurers have to be accredited, and they have to, as part of that accreditation process, report formal complaints. Well, they don't like to do that. And so it could be that by filing a formal complaint, the insurance company says, well, Let's just get this resolved right away, and maybe we don't have to proceed with that. One other step that you can take is to access help from the government. So I mentioned filing a regulatory complaint with a state or with the federal government. You can also call an elected official, someone who's elected to the state house or the state senate or to the U.S. Senate or U.S. Congress, and say, I've done my part and I'm trying to navigate access to care that I've paid for under my health insurance policy, and I really could use your help too. Elected officials often have someone in their office responsible for helping constituents, and it's their job to work with you, and they just might be able to help you out in a way that's not necessarily expected. So you can give that a try. So in summary, I hope that you found this encouraging. That's one of the most important resources that we provide is encouragement. The resources on Cover My Mental Health are free. They can help you with medical necessity letters. They can help you to access help from friends and family, from the government, even from employers who might be able to help you if it's insurance that you have through work. And if at first you don't succeed, there are steps that you can take, and I would encourage you to do so. Lastly, here's my contact information, and I welcome any email that you might send about how to use our resources. You can certainly share, and I would love it if you'd share information about how you've used our resources to help you overcome insurance obstacles. And maybe most importantly, I hope that you'll share this information and maybe this video with a friend or family member, because too many people struggle with accessing care to mental health and substance use disorder, and insurance obstacles should not be a reason that you can't get care. Thank you very much.